Um, Welcome back to the deep dive. Today, we're looking at a shift in the world that is honestly a little mind-bending. Usually, when we talk about medical travel, the story for decades really has been pretty consistent.
Right. The general rule is if you get sick and you have the means, you fly west.
Exactly. You go to
Sure.
the Mayo Clinic in Minnesota, you go to Harley Street in London, maybe Germany for the specialists. That has always been the gold standard.
That's been the standard narrative, yeah. The assumption being that the West just holds the monopoly on cutting-edge medical tech and the best outcomes.
Right. But we are looking at a stack of reports today, specifically focusing on data from early 2026, and it suggests that flow is completely reversing.
It really is.
And we aren't talking about people flying to Asia for a quick nose job or, some dental work. We're seeing patients from the UK, the US, and Canada flying to China for some of the most advanced high-stakes procedures on the planet.
It's a massive structural realignment. And we need to be clear right off the bat, we aren't just talking about cost savings here, though that is a huge part of it. We are talking about speed, and we are talking about volume.
To kick this off, I have to mention this story I saw trending everywhere in early 2026. Did you see this in the reports? The British influencer, Amy?
I did, yeah. It's a perfect case study for what we're discussing today.
So she is documenting her whole medical journey on social media. She's in the UK dealing with the NHS, and she was facing a 2-year wait for a specific treatment. 2 years.
Which is an eternity.
Right. Depending on what you have, 2 years is a literal lifetime.
And unfortunately, that's not uncommon in many Western systems right now. Those post-pandemic backlogs are still just a major, major issue.
Exactly. So Amy decides not to wait. She flies to China. She gets the treatment done start to finish in 13 days.
And then she posts the bill.
Yeah, she posts the bill. In the UK, if she had gone private to skip the line, it would have been around 35,000 RMB equivalent. In China, she paid under 3,000 RMB.
That is a staggering difference.
It's less than 10% of the cost. So the mission for our deep dive today is to really understand not just that this is happening, but how it works.
Because it's not magic.
Right, it's not magic.
Yeah.
We want to focus on high-stakes fields like oncology, orthopedics, and cardiology, and then look at the logistical reality of actually getting there.
And while Amy's case might sound like an outlier just because she's an influencer, it's actually highly indicative of this larger trend. We call this the medical pivot.
A medical pivot.
Right. China has positioned itself as a top-tier destination for complex medical tourism by leveraging three specific pillars. You have speed, you have volume, and then a very tricky one, logistics.